All right, so you've learned all about qualifying. Now it's time to learn about that precision tool in your arsenal, the scalpel. This next lesson is something very hard for most hospice sales reps to do, and it's called closing, or asking for the referral. Asking for the referral can be difficult for a lot of sales reps. It means being assertive, confident, and laying it all out on the table. But if it's not done with precision and care, what could get you a mountain of referrals could instead turn your referral sources away. So are you ready to learn about how to close properly and get those referrals? Let's get to it. The fifth module, closing. Lesson 1, asking for referrals.
There's one skill that if you'll put it into play right away, I can guarantee you will increase your referrals. So if I got your attention yet, one skill guaranteed to increase your referrals. That's asking at every call if there's anybody we can help them with. Asking for the referral. Now notice I said asking for the referral, I didn't say begging. We never ever beg. Okay, we never ever make it about us, it's about them. But if we're not asking at a minimum, is there anyone that we can help you with today? Which patients and families should we be talking to about hospice so they understand hospice and are better able to make a good decision when the time comes? Things like that. If we're not asking, is there anyone else, then we're really shooting ourselves in the foot. Now, I'll tell you a little story. Okay, we train a lot of hospice liaisons, a lot of hospice nurse liaisons, a lot of hospice nurses that are now in the sales role, and then just people that are without a nursing background in the sales role. But I think one of my favorite examples about the power of asking for referrals was a nurse that was in a training class we did, and she was, for her program, she had been like the first hospice nurse, and then as the program grew, they asked her to be the salesperson that would go out and sell the program. So she ended up in our training class, and she basically had the old hospice, not that she was old, but kind of the old mentality, which was, I'm a hospice nurse, this has got nothing to do with me. So throughout the training, there was some pushback, there was some resistance, but when we got to talking about, being able to go out and ask for referrals, she just basically said, you know what, that's not going to be me. I'm not a car salesperson, I'm not going to go out there and just beg for business. We talked about it, and I assured her that if she would just try it, that there was the one thing that could increase her business. So probably about 3 months after we did that training, I get this call from an excited nurse on the phone, hospice salesperson on the phone, who's like, Mike, guess what? It's been a little bit slow lately, and I was trying to figure out what to do, and I remembered what you said about if I asked for referrals, that they would come, And so I was in one of my facilities, and I thought, what the heck? And I asked, and you know what? I got 2 referrals while I was there. I asked at another place later in the day, I got another one. I got 3 referrals today because I asked them if there was anybody that we should be talking to about hospice. So she was excited. I felt compelled to ask and make sure that this was the same nurse that had been in the class because, boy, it didn't sound like the same person. But here's the rest of the story. This hospice nurse was very effective in her sales of it, and went on to be, her dream was to be the manager, the director of the hospice program for this organization. And you know what? Today she is that director. And she has salespeople that report to her. And she's shared with me the fact that the first thing she tells them is, if you don't ask at every account if there's somebody we need to be talking to about hospice or there's somebody we can help them with, you're not going to be working for me very long. So she saw the power of it, and she's seen it continue as she's had these salespeople that she's now responsible for that are reporting back to her. So it's a critical skill to your success. And as we've talked about, it's something you've got to be able to do in your own words, within your own personality, because you've got to be comfortable saying it. If it comes out that you're uncomfortable, if you're worried about it, then guess what? It's not going to have the same effect. And you're going to feel like, uncomfort is there, and then you're not going to do it. So let's talk a little bit first about what would be a realistic goal. Because what we find at the end of our Square One boot camp is that we ask the students to go through and list the skills that they're going to put to work when they get back to their territory. And one of the very common ones, which makes perfect sense to me, and we're glad to hear it, is I'm going to ask for more referrals. Well, as a goal, that's not very well stated. So we ask then, how often are you going to ask? And they're always, well, I'm going to call every call. Really? And right now, how many calls do you make that you actually ask for a referral on? Well, not very many. And we have to point out that probably it's more realistic if they set a goal that would be like, I'm going to ask in half of the calls I make for a referral out of the gate, right? Because then they're not setting themselves up for failure. And then set up a very simple process to measure at the end of each call. It's either a check mark or a minus. It's a blue bird or a unhappy face. Happy face, unhappy face. I don't care how you do it, but just make it easy. And on your calendar, it's either yes or no. Did I ask or did I not? And track that on a daily basis. Track it for the week, add them up, and figure out what percentage of the time you actually ask for referrals. Now, you'll also know how many referrals you got from that, and you can see the power of it. But if I establish that baseline, and maybe the first week I ask in 60% of the accounts, then the next week I could have as a goal 70% and 80%, and then getting to the point where you're really asking on pretty much every call. And you should be good at asking at least once on every call. We'll talk more about, building this into your repertoire, but, saying things like, based on what we've discussed today, which patients would benefit from this most? Not, do you have patients that would benefit, because they can say no. Which patients? If I've made a good case to the doctor about how our hospice program is going to manage their end-stage CHF patients and keep them from calling the practice, cut down on the amount of time that his office is spending managing those patients, et cetera, all the benefits, right? And I've made a good case to it and they agree to it, then ask them, say, let's make a list of your 10 most troublesome, biggest, challenge end-stage CHF patients or CHF patients, the ones who are calling all the time, bouncing in and out of the ER. Let's make a list of 10. Let's get them onto our hospice program. We'll evaluate them to make sure they're appropriate for hospice. We'll visit with the families. We can do that in tandem with you or after you've ordered hospice for them. But let's get them on our service so you can see the benefit for yourself. Okay, so you've got to be able to ask those questions. You've got to be able to phrase it in your own words, but it truly is going to be your best way to multiply your results. When we talk about multiplying results, if you're going to ask them to give you a patient, I wouldn't do that. I would ask for a minimum of 3 patients. Now, why do you say that? Because it's the same, really, asking them to try us with 3 patients as 1 patient. And what's the worst case? We ask for 3 and we get 1? Okay. Also, what we know about hospice referrals is that Murphy's Law comes into play. If this is a new account that I've been working really diligently to develop, what's going to happen? They're going to give us a patient, and for whatever reason, it's not going to fly. They're going to be actively dying. They're only on our care for a very short period of time. They have the horribly dysfunctional family issues. Not that we experience that in hospice. And we're in a position where we get that one referral and we can't really show them how we're different. So if you're worried about, and sometimes we get this pushback and say, well, I don't know, Mike, isn't that going to be pushy? Aren't they going to think I'm being pushy? If someone were to say or challenge you and say, gosh, 3 patients, that seems kind of pushy. I don't think that's going to happen, but let's say it does. You've got a very professional and valid reason for it. They need to experience our difference. And what we know about hospice referrals is that some of them may be shorter term than others. Some of them may have other dynamics at play. We really need to try us with at least 3 patients to really see the difference of the program that we have and we offer. So again, it's got to be in your own words. You've got to be building these questions so that you can ask in an appropriate fashion given the person you're dealing with and the location you're in. Your referral people in the referral center, or if you're taking a referral for someone, should always ask, who else do you have? Who else should we be talking to? Who else do you have that you're thinking about discharging this week that would be appropriate for hospice? Don't let the fact that they're calling you with a referral deter you from asking for additional patients. It really, let's take the case of a discharge planner, for example. We're helping them be better at what they do. We're helping them be better at their job. And why do you say that? Well, here's what my belief is. Discharge planners live in the moment. They have a list of names that they have to effect a safe discharge into the community, and they have certain time restraints or pressures to get them out of their facility. They're going name by name. So if I'm calling about the name on the top of the list, and the hospice professional, such as yourself, says, well, do you have anybody else we should be talking to? And that causes them to look down the list and say, oh yeah, well here's this one and this one. Then you've just gotten 3 referrals when they called you with 1. The old adage is that nobody's ever happier with your service than when they're purchasing it. So if they're calling you with a referral, they're happy with you and they feel good about it. It's the best time for them to give you more patients. And again, you can make them better at their job. So always be prepared to ask. And at the very least, again, it's who else should we be talking to? Is there anyone else we can help you with? Based on what we talked about today, which patients would most benefit from our services? Doctor, we've discussed some of the issues you're having with your CHF patients and how much trouble they are and how much time it takes of your office staff. Who should I sit down with to make a list of the 10 worst so that we can show you the benefit to you and the number of phone calls we'll eliminate, the number of them that we'll keep out of the hospital, and then sit down and make that list. If you're talking to a hospital, in today's world, hospital discharge planners are getting a lot of pressure from the hospital administration to make sure that when they discharge a patient into the community, and there's a list of certain diagnoses, CHF among them, that will cost the hospital money if they get readmitted within 30 days from discharge. If you can talk to them about how your programs will help to keep those patients from coming back in within 30 days, you can build a really good case for them to use you. But shame on you if you build that case and then don't close the deal. So let's say that you're meeting with some people in administration. They don't actually pull the trigger and send you patients. So you might think, all I've got to do is make the case, but that's not right. You've got to make the case and then ask them for a commitment for what our next action step is so they can truly get that benefit. So you've got to be in a comfortable position to close the deal. So prepare those closing questions before you go into the account. In the case where I'm making a presentation to the key administrators in a hospital and we're talking about strategies to keep patients from being readmitted, I've got to be able to ask, who should I sit down with to develop a process where those patients can be identified and we can be called on a regular basis so that we can make this happen starting tomorrow? Those are the questions, those are the strategies, those are the tactics that are going to drive the business and drive it in a big way. And as I said early on, this is the one thing you can do that's guaranteed to increase your referrals. And if that's not enough motivation for you, think about this. If you're not asking and your competition is, it doesn't matter what kind of relationship you have, they're getting the business and you're not. And how many times have we seen situations where reps have a great relationship with people and they're not asking for the business because they're being nice, or they're, we're really friends now, so I'm not comfortable with that. And the people love to see the rep coming. They love to talk to them about the weather and the sports team and little Sally's soccer game and everything, but they're giving the business to somebody else. And yet if the sales manager asks the rep, hey, how come we're not getting you business from Dr. Bob? What's going on over there? And say, well, I think it's been slow. They love us. They wouldn't use anybody else. If you hear those words come out of your mouth, you need to slap yourself and say, whoa, wait a minute. I'm taking them for granted. And I'm not asking them to commit to give us the business. I'm not doing my job. If you're good at asking and making people feel comfortable about it, they will know when they see you coming that you're going to ask. And countless reps have shared with us that once they got that into their repertoire, that they could literally see people that would see them coming down the hallway in the hospital or on the skilled facility, see the hospice sales professional coming towards them, and you could tell that they were starting to look around and think about who they had that might be a good referral for them, because they knew they were going to ask. So you're training the accounts you deal with. You're training them to know that you're going to ask. One last thing. If you don't ask and they don't think about hospice, the result is a patient who goes without hospice care, a patient who potentially dies without having had the gift of hospice for they and their families. So if you're having difficulty getting comfortable with asking, is there anyone else we could help you with today? Is there anyone else that would benefit from our services? Which of your patients should we have on our hospice program today? Based on what we talked about today, which patients do we need to get admitted to hospice as soon as possible? If you're not comfortable doing that, then you're not going to fulfill your mission and you're not going to be as successful. So make sure, if there's one thing that you put into your repertoire, that you get out of that toolbox on a daily basis, it's your ability to ask good closing questions. Prepare those questions in advance, and before I go through the door, I know what I want to probe on, what I want to find out, and also how I'm going to ask for the business. Ask for those referrals. Ask and ye shall receive has never been truer. Okay, so before we go into some of the role play examples of asking for referrals and asking those good closing questions in a role play format, I thought I'd just go over a few examples of questions that you may want to be thinking about, because I'm sure you're going to want to be role playing as practice as you're driving down the road and listening to this, or when you're working with one of your peers or your boss. One of the simple questions to ask is, do you have any other patients who are going home this week? Which patients are you taking home with you this weekend? It's a good question to ask doctors, because what we're getting to is those patients that they're really worried about, that they're really concerned about, that are really troubling, and those are the patients who are going to be typically very appropriate hospice referrals. Tell me about those patients who are on a first name basis with your answering service. It's kind of a cute way to ask, who is it that's calling at all hours of the night? Right? If we can eliminate those calls, we can bring a big benefit to them. Tell me about those patients that you've had to make some radical medication changes for, or you've changed multiple medications on this week. Which of the patients in your practice are you struggling with managing at home because they've got real severe pain issues? Tell me about any patients that you wouldn't be surprised if they weren't here, say for the 4th of July, if it's early in the year, if it's in the summertime, that wouldn't be here for the holidays. What we want them thinking about is, what are those patients that they wouldn't be surprised if they wouldn't be here in about 6 months from now, right? We want them to start thinking about those patients who essentially they feel like have a terminal diagnosis and have a limited life expectancy. Obviously, those would be good hospice referrals. Doctor, which of your patients wouldn't surprise you if they were back in the hospital by next week? Again, we're going towards and looking for those patients who are going to be their most difficult patients and the ones who are most fragile and most at risk at home, which are the ones we're looking for as hospice patients potentially. Tell me, what's going to be the easiest way for you to refer your patients to us? And that would be an assumptive close. We're assuming they're going to send us the patients. So I'm going to ask them what's going to be the easiest way and get them to commit to an easiest way. Sometimes that can be a good way to get them commitment that you wouldn't get necessarily just by asking them, are you going to send me any patients? We can talk about then, if we're talking about easiest ways, we can get to service issues and how we're going to make it easy for you. We're going to construct a program that's going to make it easy for you. What is the easiest way for you to send us our referrals? Great, so should I set that up with Mary? May I let Mary know that you and I spoke and she suggested that the hospice referrals be easiest to fax over to us. One that you can use, especially if there's a compliment from someone, like a case manager or someone in a facility, a doctor, about our care, is asking the simple question, since you're so happy with the care we've provided for Mrs. Jones, which other patients would be in similar situations and would also benefit from our hospice program?
Lesson 2, the role play. So you got anybody for me today?
No, I don't.
If you need me, you've got my card. Just call me anytime.
Oh, okay, thank you.
So can you think of somebody that maybe could benefit from our services that we could give a call? Maybe we could go out and talk with them and just see what's going on?
No.
Okay, so let's talk about those closing questions. The first one, which is a variation on a question that we hear all too often, got anybody for me today? It's a variation of the question, do you have any referrals for me? What do you got for me today? Those kind of things. First off, we don't beg for referrals. So it's just a bad idea. People don't like it, and to the extent that anybody's worried about sounding like a used car salesperson, this would be a good way to add to that perception. So don't be out there begging for referrals or feeling like that somehow you're entitled to referrals. So I would strike that question if you're using that one at all. The next one, I'm not sure is exactly a question. If you need me, you have my card, call me anytime. Start out with, if you need me, of course they're going to need you. Why are you going to plant the seed of their mind that they might not? Just the fact that they've got their card and you offer for them to call you is definitely not going to be a close. It's certainly not going to get you a lot of business. So don't make the assumption that you can give somebody a card, a brochure, or anything else, and that they'll call you. If you're going to give them a card in the process, let them know that they can call you anytime, but you'll follow up with them next Tuesday when you're out in this area. So never leave it up to the client or the prospect to call you back. The third question is a very wishy-washy type of question, and it's a little on the long side. Can you think of somebody maybe who could kind of possibly benefit from our services, and we could maybe go and talk with them or see what's going on? They use maybe, possibly, maybe again, and we're going to see what's going on. So that question needs to be shortened considerably and ask them something in the affirmative, certainly not in the if or when you might possibly have something for us type of time frame. And as you know, what we recommend is that you have your closing questions crafted and written and ready to go before you ever go into there to make the sales call. And the reason for that is so that you don't end up throwing out any kind of lame questions such as these, because none of these three are going to get you very far.
Do you have anyone else going home this week?
Yes.
So who can we take care of today?
Mr. Jones.
After our discussion today, can you identify patients in your practice that can benefit from our services?
Yes, I can.
Do you have any patients who come to mind who wouldn't surprise you if they ended up back in the hospital this weekend?
Yes, I do.
Which patients are on a first name basis with your answering service?
That would be Mrs. Brown.
And since you're so happy with our care for Mr. Jones, who else would you have that would benefit from the same high level of care?
Mr. Hampton.
So let's talk about some of the other closing questions, which are actually pretty good questions. Do you have anyone else going home this week? That's perfect. If you're talking to a discharge planner or someone else in a facility or hospital, what do we want to know? Do they have anybody else going home this week? They can give you a name, or they come up with the patient, and you can talk about it and see if it's not going to be somebody that could refer to you. Who can we take care of today for you? It's a variation on the other question, which is, do you have anyone else we can help you with today? Excellent way to close a statement. Gives you the ability to come back and ask one last time, is there anyone else that they have? After our discussion today, can you identify patients in your practice that can benefit from our services? And I would say that's a pretty good question, but I think we could probably tighten it up a little bit and make it something more like, after our discussion today, which patients in your practice would benefit from this service? Do you see the difference there? Instead of asking if they can identify patients that could benefit, we're asking them which patients would benefit. So always try and ask questions in the affirmative. Make the assumption that they have them, and you're helping them identify them. The next question, do you have any patients who come to mind who would not surprise you if they're back in the hospital by the end of the weekend? Clearly, we're looking again for those patients that would be good for home health or hospice services, because we can keep them out of the hospital. So we're looking for the people who are obviously up and down and have a number of things going on. And so we're asking them if they wouldn't be surprised that they'd be back in the hospital. This gets them thinking about who are those patients that they wouldn't be surprised to be sent back in the hospital, most of whom are going to be good referrals for us. Which patients are on a first name basis with your answering service? Again, these are the ones that are calling all the time. Those are the patients that we're looking for that we can help them with. Plus the fact that it conjures up in their mind the idea that if they're talking to their answering service, that means they're either getting paged or they're having to handle it when they get in the next morning. We want to get to their pain. So if you ask them who's on a first name basis with your answering service, these are the patients who are a pain for them to take care of. The next question is a great question as far as the assumptive close. What's the easiest way for you to send referrals to our agency? That assumes they're going to go ahead and send them to you, which is the right way and the right stance to take. So find out from them what they consider to be easiest, and then you're en route to getting those referrals flowing. And the last one is a great question when you're talking to someone who's referred a patient to you, and any variation along these lines is going to work well. But since you're happy with the care we've provided to Mr. Jones, who else would you have that would also benefit from the same high level of care? So we're reiterating to them the fact that they are happy with our care of Mr. Jones, because presumably that's what they've just told you. And you're asking him who else would benefit from the same high level of care. Excellent question, and you're painting the picture that A, reinforcing that they're happy with us, and B, reminding them that we provide a high level of care. So I think those are some great closing questions, some good, some bad, but hopefully this will help you in constructing your closing questions. Just make sure you've got them ready and you're prepared before you walk through the door. Well, that about wraps up our role plays dealing with asking closing questions.
Let's talk about what you've just learned. One way to immediately increase your referrals and admissions is to ask for the referral. While this may seem scary at first, once you find ways of asking for referrals in your own words, it will become much easier, and it works. You'll find that over time, your referral partners will get used to you asking and will be expecting you to ask. It doesn't seem so scary anymore, does it? Most sales reps we encounter tell us that while it was scary at first, after a few calls, it became much easier. We get stories all the time of reps telling us not only is it second nature to ask, but the referral sources are all ready with referrals because they anticipate the question. Now, who wouldn't want referrals handed to them on a silver platter like that? So now that we've taught you the basic components of a great sales call, introductions, qualifying, and closing, let's get to the more advanced components. This next section is something we all encounter on our sales calls, yet most of the time we don't know how to handle it. It's about overcoming objections, and it will teach you how to handle every objection in the book, from the standard, "we don't use hospice," to the difficult, "your agency did a bad job on one of my patients." Ready to learn how to handle objections? Pop in the next CD.